disease control and infectious disease management. He's been advising our public health teams in Essex, and I'm delighted to say joins us once again this lunchtime. Afternoon to you, Bharat. What do you make of the announcement?
Hello, good afternoon. The announcements on children's vaccination, I'm very pleased and happy about. With regards to giving boosters, it is a clear example also, we mustn't lose sight of it, is we're doing what we're doing because we can. In other words, we're a rich nation and we've got supplies of vaccines. The evidence for needing boosters is not so robust. I'm not against boosters, not at all. Please don't get me wrong. However, what I say is we've got other things to do, other important things to also help countries abroad who have not had any vaccines. Even eminent developers of the AstraZeneca Oxford vaccine said the same thing, that the evidence for boosting is not so strong. But we are where we are. If we can, and we're doing it. That's not a bad thing.
Does the vaccine not start to wear off, though, and all the people that have had double doses would need a top-up?
It's a good point to ask and address, and this is how I would look at it, is the evidence indicates that the immunity slowly starts to decrease with the passage of time. What we are not absolutely sure about is how much that decline is, and furthermore, does everyone over 50 really need a boosting when we could be sharing our vaccines? Of course, if you've got the vaccines and you've got the money, you can be boosted and kept in peak performance, so to speak. But yes, we know that the immunity tends to decrease a little bit, and I was more for immunizing the extremely vulnerable. There I can see a clear rationale for doing so, whereas just a blanket boost for everyone over 50 is not a bad thing, but I wonder how necessary it is.
Will this be an annual occurrence?
Again, we don't know, because time will tell locally, nationally and internationally how well the vaccines perform. And it may come to pass that having immunized people 3 times, that they maintain and retain their immunity for a lot longer. And if that is the case, hopefully we won't need regular annual vaccines. But at this point in time, no one knows. We will know in time.
Will this prevent any winter lockdowns? The government have stressed they don't want to go back to that again. Will this prevent that?
We don't know, but what will prevent, or at least subdue it or reduce winter NHS pressures, is a high uptake on the seasonal influenza vaccine, as well as maintaining infection control measures, such as wearing of masks in public places where there are crowds of people, and also suppressing infections in the younger age group. When we do all those mini slices of interventions, that is what will work. And I hope Prime Minister Johnson will say it today and backtrack on you don't need to wear masks and make it mandatory that in crowded places and in sensitive places you will wear them, but you will wear them properly and of a better specification.
Dr. Bharat Pankhania, Senior Clinical Lecturer at the University of Essex.